Good afternoon, everyone. This is Dr. Cody Al from Baseline Chiropractic here in Vancouver, bringing you another video this week. Today I'm going to talk about my approach on addressing issues and seeing what's going on. So my approach that I use is a joint-by-joint concept, which is coined by Michael Boyle. And so a lot of practitioners have used it to coin and change some of their approaches. So basically, if you look at this, the joint-by-joint approach, it looks a little complex, but it's based on two things, mobility and stability, which we will do future videos on explaining the difference between both of them. However, when you look at this, it's rather simple. So if you're looking at toes, ankles, hips, upper back, shoulders, upper neck, they all point to mobility. And the feet, the knees, the low back, shoulder blades, and the lower middle neck all point to stability. However, one thing that may not be as apparent is these joints are actually alternating. So when you look at the toes connect to the feet, so the toes are mobile, the feet are stable, the ankles are mobile, the knees are stable. The hips are connected to the knees, so they're mobile. The low back is stable, the upper back is mobile, the shoulder blades are stable, the shoulders are mobile, and then lower and upper neck are stable and upper neck are mobile. So that's how we look at it, but when we look into the arm, it's the same thing. So since the shoulder is mobile, the elbow right here becomes stable, and the wrist here is mobile, and the hand is for stability. So that's how the whole body works together in figuring out this. This is not by any means saying that the shoulders being mobile don't need any stability. It's just the primary use of it is mobility. So in my terms, how does this affect my care? What I look at is, for example, let's use the knee. So if the knee is in pain, someone comes in with knee pain. So my thing is, yes, I'll address and look at the knee. However, the main problem with the knee, if it's a repetitive injury, if it's traumatic, it's a little different. But if it's a repetitive stress kind of issue, then I'm looking at the hips and the ankle at the very least, because if, for example, the hips are lacking mobility and the ankles are lacking mobility, then the knee is going to have to take on mobility in order for you to function. So therefore, the knee becomes this symptomatic area because it's taking on too many issues. And so it is the one that is in pain. As a result, if we clear up the hip or the ankle issues, or maybe both of them, then the knee itself will actually heal itself because it doesn't have to deal with the extra forces. So that's more of my approach. Whereas if I was to work on the knee, it may not actually take away the problem because the pain may go away, but the problem still exists. So I'm more about looking at where is this coming from? What is the problem? And seeing what to do with it. So I'm